Good afternoon, everyone. It's so wonderful to see you here on this sunny day. Thank you for attending Fort Valley State University Cooperative Extension, Mental Health Management, and the Science of Vaccines during COVID-19. I know it has been a difficult year, but we will be able to see our way through with the information provided today. Today, we have two enlightened speakers to assist us in our travels through COVID-19 pandemic. Jacqueline Caskey-James and Joycelyn Warren will educate us on mental health and vaccine education during this time. Just a few housekeeping notes. Please mute yourself, place your questions in the chat box, and they will be answered after each speaker completes her presentation. And finally, there will be an evaluation questionnaire sent to you by email after the program. For those savvy folks, tech savvy folks, the link will also be placed in the chat box for you to complete. Once again, welcome and thank you for attending. Next, we will have Mr. Philip Petway, our 4-H agent, with the introduction of the speakers.
Good morning. I hope everyone could hear me well. It is my pleasure to introduce our speakers this morning. I'm going to introduce both of them at one time so that we won't have to do it in between the questions. So with that in mind, let me first introduce Ms. Jacqueline Caskey-James. She is a licensed professional counselor, nationally certified counselor, certified professional clinical supervisor, and a certified life coach. Ms. Caskey-James earned her bachelor's degree in psychology and a master's degree in mental health counseling from the Fort Valley State University, where she serves as Director of Counseling and Outreach Services. She is responsible for all aspects of counseling and wellness at the Wellness Center. She provides counseling to students, supervises undergrad and graduate level interns. She also conducts outreach programs and engages in consultations with the campus community. She was selected by the University of System of Georgia Chancellor Wrigley as a member of the University Systems of Georgia Mental Health Task Force. She is, of course, serves on a number of professional boards and associations, including the University System of Georgia Counseling Directors Association, where she served as chair-elect 2017-2018, and the chair 2018-2020. Ms. Caskey-James is the owner and executive director of CJ Hope's Professional Mobile Counseling, LLC. The H stands for Helping Other People Evolve, HOPE. And our next speaker is going to be Ms. Joycelyn Warren after her. She is currently the nurse manager of Twiggs County Health Department. She has been in public health for almost 5 years now. She is also a family nurse practitioner and uses her skills not only in Twiggs County, but in other health departments in the surrounding areas. Growing up in rural Georgia, she learned at a very young age that she wanted to help provide rural communities with the resources they needed. This led her to pursuing a nursing education. She most recently graduated with her Master's of Nursing in 2019 from Georgia College and State University with the help of the ANU grant. The ANU grant helps to further educate nurses to become providers like nurse practitioners in rural communities. It is my pleasure now to bring our first presenter on, Ms. Jacqueline Caskey-James.
Hello.
Hello, Ms. James. Yes, we can. You can start sharing your presentation.
Good. Thank you so much for that warm introduction. I'm very excited to be able to share with you as I share my screen that this is Mental Health Awareness Month. And if I can get this to work, there we are. With this being Mental Health Awareness Month, this way back in 1949, in the month of May, started to be observed because mental awareness in that day was still very somewhat taboo. So the Mental Health of America organization came together and put a toolkit together working toward destigmatizing mental health so that now, up until 2021, we can still celebrate mental health awareness so that we can provide information through our local media, through local events such as today. We've had various film screenings to depict a lot of mental health issues. We're gonna get started, and this is gonna be an interactive session. So I want you to get your pen and paper out because I'm gonna leave you with some take-home messages that I don't want you to share them in the chat box. This is going to be information for you and your own good self-care. We're going to start out talking about depression. That was one of the leading issues because we've been on lockdown. A lot of countries are still on lockdown. So we're finding that a lot of individuals are showing us signs of depression. And depression has been defined or classified as a mood disorder. And it basically, you find that the symptoms will depict to determine what level of depression you may be experiencing. You may have a loss, or you may lose a job, or you may not get the promotion that you feel that you've earned, and you may have a few days of sadness. We'll look at that as a situational depression. It's not long-term. But there again, you may experience a traumatic event that's going to take you a little bit longer to get past. For example, if you have a cold, people will say, oh, you can get over that cold pretty easy. Some people look at depression the same way. They don't equate, because with depression, there needs to be some form of treatment, be it talk therapy, if it's situational depression, if it's long-term, and we determine whether or not it's long-term based on the symptoms that you provide to us. Say, for example, you've been sad for 3 to 4 weeks. You've had a loss of pleasure in what you enjoy doing. The depression has just zapped you from your personal energies, and you're feeling worthless. And then you start to think of death. We measure utilizing our tool, and that one tool is our mental health Bible. It's the Diagnostic Statistical Manual. And that helps us to determine frequency and duration. And that helps us to assign whether or not this is situational depression or whether this is long-term depression based on how long you have been suffering. So how do we cope? What do we do? Well, say if it's situational depression, you enjoy gardening. That was one of your pleasurable events. Well, we try and work hard to connect ourselves to a mental health professional. And as a professional, I would suggest to you, let's get back into some of the things that you enjoy. If we exercise, exercise raises the chemical in our brain called dopamine, and that too will help to reduce some of those depressive symptoms. Think about what are your personal responsibilities. That's a part of what you have to do, and your personal care of your own body. When you see that you're participating. And with psychotherapy, our talk therapy, sometimes if it's a long-term depression, we may need some medication along with talk therapy, but balancing the two will give us good efficacy, because now we can see that individual raise their level of function. Now, along with depression, usually comes some anxiety. And anxiety has just been defined as the fear of the unknown. We tend to worry. What if? Woulda, coulda, shoulda, woulda. No. When we feel those, we recognize it immediately. That's what this is about today, to be able to help you to recognize. Because when we're in that depressive state and the anxiety is taking over, we start to think negative thoughts, because depression can lead to poor self-esteem, and anxiety can also lead to poor self-esteem. And then we start having what is called irrational thought. Someone who regularly perceives positive feedback will benefit from changing negative thoughts to positive thoughts. So I'm going to ask you a question, not for you to answer in the chat or for you to think about. If you were having an irrational thought, such as, I'm going to get fired, and I know I'm going to get fired, is there substantial evidence for that thought? Is there evidence contrary to that thought? Or am I attempting to interpret this without any evidence? And then you can talk to a friend, a real friend, someone you can trust, not an associate, but a real friend. A friend is going to tell you the truth. And if this situation turns out to be positive, unnecessary worry. So that's where we go back to our coping skills, and we put our coping skills back to work. We can also, with those irrational thoughts, decastrocyze. That's where we have those cognitive distortions, and those irrational thoughts become overpowerful. You find that more in your long-term, major depressed individuals, because they don't find that as a normal part of living. They distort things, they elevate a problem, they'll exaggerate a problem, make it worse than it really is, when truly it's not completely as they say. So we're going to move swiftly out of depression and anxiety, and we're going to move into how can we build some happiness from what we've experienced. We've reached out to our mental health professional. We've reached out to our psychiatrist if medication is necessary. We've provided the small steps. We're putting coping skills into play to make sure that we can achieve that homeostasis, which means that balance in our lives. And now we're looking toward achieving a level of happiness. So what does that look like? Well, say we get a promotion, or we are in a new relationship, and we will be talking about relationships today. But when we become happy, today I'd like to teach you that happiness looks like gratitude. I'd like for you to write down 3 things that you're grateful for today. Happiness looks like some form or act of kindness. Make a conscious effort to do something today nice for a person. if it's no more than just to hold the door or the elevator when they're coming. Possibly after work or on your lunch break, take you a little stroll and get some fresh air and exercise, because that's your good self-care, building on your own happiness. I'd like to introduce to some and maybe present to others meditation. Visually think of that place you'd love to be and go there. If it's a nice warm bubble bath, take that. Very, very effective in building happiness. If you are a journaling person, take some time and write about your positive event today. We want to foster relationships. We want to build strong connectedness, because there's not an I in team and there's not a you in team. It's a team. So we're going to work together to share this information so that you can build some happiness in your life. If happiness is not coming right away, simply because you're housing some non-forgiveness, let's talk about what forgiveness is in order to achieve that level of happiness to balance our mental health. Forgiveness is a process where someone who has been wrong chooses to let go of that resentment. And once you let go of that resentment, you treat the wrongdoer with compassion. You want to make a conscious effort to remove that pain from your life and possibly the life of the wrongdoer. So let's remember, how are we going to forgive? I'm going to teach you. We're going to reconcile, because Michelle Obama told us, when someone goes low, you go high. Let's reconcile. Let's forget the injustice and live in the moment. We're looking at well-care. The mental health is the healthy side. The mental illness is the ill side. We're going to condone and we're going to excuse any ugliness that was shared during that period that caused you not to want to forgive. And remember, granting mercy is going to be good for your own contentment. So let's learn to forgive in order to achieve a level of happiness so that we can maintain a strong, safe mental health. I've described the anxiety, so I'm moving through stressors. What are stressors? Stressors can be defined as any type of change that causes the physical, emotional, or the psychological strain on our bodies, on our minds. Everyone in this meeting has experienced some form of stress. If it was no more than working to pull this together, there was a level of stress. So how do we cope? We cope with rewarding ourselves after we've completed our task. If the stress was a positive stress, let's reward. If it was a negative stress, then let's talk to someone about it. When we start talking to someone, we start building healthy relationships. Here are 5 ways of relieving your stress. You want to eat good. You want to get some exercise in. We definitely want to sleep well at night. And you know, as we get older, we need to make us a task list so that we can remember the important things that we need to do and we won't become overwhelmed, creating stress, leading to our depressive symptoms and anxiety. So we're with relationships now. So we're learning to get along with others while also asserting our own needs as being essential, because now we're developing a healthy relationship. And I'm gonna leave you with an acronym, a couple of acronyms that I'd like for you to take home as a take-home message. And the acronym, is going to be Dear Man. But behind every alphabet, you put a period, DEARMAN. And I did not make a PowerPoint for this because I wanted you to be actively listening, which is a part of your healthy mental health. So Dear Man, Dear is going to be describe the situation objectively when you're building a relationship. This means sticking to the facts and avoiding your opinions and your interpretation. The goal is to get everyone on the same page. That's your D for describe. Your E is express. Let others know how a situation makes you feel by clearly expressing your feelings. Don't expect others to read your mind. But how about using a positive I statement? I feel excited about given the opportunity to speak to you today. That's my positive I statement. So the E is for express. The A is assert. Don't beat around the bush. Say what you need to say, but say it in a tone that's very respectable. Remember, we're a team. Don't say, oh, well, I don't care. I'm not going to get those reports in, but do say, I do care, and I'm going to work on submitting the reports by close of business today. Positive I statements. We work that into our everyday language, and we find ourselves constantly repeating positive I statements. So the A is for assert. The R is for reinforce. Reward yourself and reward people who respond well and reinforce why you decide the outcomes were positive. And this could be as simple as a smile or thank you, because a smile is recognized in every language. So the R is for reinforce. The M, be mindful. Don't forget the objectives of whatever the interaction is as you're building this relationship. It can be easy to kind of get sidetracked into a harmful argument if we lose our focus. So let's stay focused and stay on task as we're building this relationship. So the M is mindful. The A is going to be to appear. Always appear confident. Assert yourself. Know that your feelings and your thoughts are just as important. The M for mindful, the A for appear, and the N is to negotiate. No one can have everything they want their way. We have to be open to negotiate. So we learn to agree to disagree. So what I've just taught you is an effective way to work on interpersonal, effective skills building for relationship building as we work together day to day and as we use this in our everyday life. And as I come to living a healthy, unhealthy, and abusive relationships. The healthy relationship means both of you and your partner can communicate, you are trustworthy, you're respectful, you enjoy your time together. But when it becomes unhealthy, you stop talking. You become disrespectful, non-trusting, unequal economically. And then sometimes the abuse will be the center or common denominator, because abuse is not always physical. You can say something that's so hurtful to an individual that you will definitely go back to your dear man and utilize those techniques. So as I close, I'd like to be able to share with you that our minds carry 3 states: the reasonable mind, the emotional mind, and the wise mind. Everyone possesses, everybody that's on this call today possesses these states of mind. But most times we gravitate toward one or the other. It's either the emotional mind, the wise mind, or the reasonable mind. The emotional mind is used when feelings control a person's thoughts and behaviors, and they may act impulsively with little regard for what the consequences may be. We see that sometimes with our young people. They're just leaving home, so they're doing and having fun and acting very impulsively. So that's the emotional mind. The wise mind refers to a balance between the emotional and the reasonable. But your reasonable mind is that intellectual mind. We learn to plan, we learn to make decisions based on fact. So as I leave you today, I'd like for you to be able to remember that each and every one of you carries the 3 states of minds: the emotional mind, that wise mind, and that reasonable mind. Because even as adults, sometimes we may become impulsive with impulsive spending, and then we think later about the consequences. Sometimes as a wise mind, we try and balance everything for ourselves and for our families. But the takeaway today is the reasonable mind. We want to work toward the intellectual side, understanding that mental health is the healthy side of the house. And that's what we choose for our students on our campus, for the community that we serve. We're looking for that healthy mind. But when mental illness appears, we as a public will see the behaviors of the ill individuals. So as a professional, it is my duty to be able to, based on the behaviors, help that individual raise their level of functioning to their baseline, which means where they are balanced, and give them an opportunity to live with life, liberty, and the pursuit of happiness. I have enjoyed being able to share this information with you. I'll be more than happy to answer any questions that anyone may have for me, and maybe the questions may be at the end of the presentation during our question and answer part of this presentation. But I've certainly enjoyed it. I'm readily available and willing. I enjoy providing mental health services for individuals. I am looking forward to being that mental health provider and being there anytime that anyone is in need of questions or services. Miss Jackie is always ready to look forward to helping the mentally ill become mentally healthy. Thank you very much for your time.
Ms. Caskey-James, we do have a question.
Okay.
And the question is, what can couples do during COVID-19 lockdown to find each other personal space since they have spent a lot of time together?
One of the things I would suggest is the couple find or put together what is called healthy boundaries. What would be a healthy boundary for the two of you? And only the couple can determine which boundaries would be offensive. We go back to healthy communicating. We go back to being honest and respectful. And once we've put our boundaries in place, then we weigh our pros and cons to determine whether or not this relationship is going to continue to be stable or unstable. But if in fact there's some physical abuse involved in this, then that will violate our healthy boundaries. So my suggestion and answer to that question is to create a list of healthy boundaries.
Thank you. Are there any other questions? You may put them in the chat. And if anyone's typing now, Ms. Caskey-James, thank you so much for your information in reference to the reasonable, emotional, and wise mind. I thank you for that insight. It makes me think more deeply into certain things. Are there any other questions? Ms. Caskey, thank you so much once again. We appreciate your information and your talent and your expertise in this situation. And we'll have Mrs. Warren next.
Ms. Tarver.
Yes.
I was typing in the chat. I do have a quick question, if possible.
I'm sorry.
Okay, I was trying to get it in, but Ms. Caskey-James, I wanted to ask, looking at the definition of depression and anxiety, we know that we all may experience that at some time. So, and I know you mentioned situational. When is the appropriate time to seek help? Because many people will probably experience depression and anxiety at certain times. So when do we know when is the right time to seek professional help?
Well, I was taught that anytime a situation interrupts your daily functioning, it's time to reach out. If you feel the need when you first experience the feelings and you've talked to a friend, or it's basically, like I said, once it interrupts your daily functioning where you can't get out of bed, you've lost your zeal for the things that interest you the most. You don't prepare meals. There's been a significant weight loss. It's a variety of symptoms that will display themselves, but it's always my suggestion, based on what I've learned through the years and still support, that when it interrupts your daily functioning, it's time to seek help.
Thank you.
You're welcome.
I have a question. So when, with the question, kind of piggybacking on what was asked, when to seek help. And when you seek and help, say if you're a couple or if you're a family, do you seek help for that individual or are you seeking help for the group?
Well, that's a good question. It's according to who the identified patient is at that particular time. If it's a couple's issue, the couples may want to meet individually first because there's always two sides to a story, and then they can come together and share that information so that you can weed out any misconceptions. If it's a child involved, the therapist may want to see the child first and or listen to the parent side of the story. So it's different approaches to how that's handled. But basically, if it's the family, the whole family can be seen together, but each individual will be treated individually. And the couple, if they're working on a relationship, we will target relationship building and not individual or group counseling, if that helps to answer your question. Does
Yes.
that make sense to you?
Yes, yes. Thank you.
You're welcome.
Ms. Caskey.
Yes.
What, switching, since I work with young people, and a lot of us have children, whatever, have you seen anything as it relates to the children's mental health, not being able to see their friends, not being able to, a lot of them stayed home from school this year, did virtual school. Could you speak to that and what could be done just to help and support them?
Well, actually, communication. That's where mom and dad, you have a job. And that job is to be able to communicate the information to your sons or daughters to help them to understand that this is a pandemic and we're trying to keep you safe. And I know that you're missing your friends. Then family activities, whether you play board games together, whether you play pin the tail on the donkey in the house, you find ways to entertain your children, reading to your children, working as a family unit so that it won't feel as though they don't have that social support. Then social media is still available and you have the controls, the parental controls for social media for your children so that they can link with their friends. So my suggestion is, as a family, families communicate, they're honest with the children because they're gonna see it on television. But the more you communicate with them, because you are the ones that they trust the most, the time that you spend with that particular child, although you're having work, you're working from home, yourself, family does fit into that model. So working with your children, communicating with your children, listening to your children, giving them an opportunity to help make dinner tonight, more responsibilities inside of the home. And if you're able to walk outside of the home, some small activities outside of the home. So building upon activities, answering their questions, and not leaving them in the dark to fend for themselves.
Thank you. Well, I'm on the right track. I've played life board game. I've made smoothies. I've never baked as many chocolate chip cookies ever. Okay.
Absolutely.
Thank you, Ms. Jackie.
You are certainly good at that.
Thank you.
Great.
Thank you. Thank you. Thank you. We ready to transition into our next speaker? Okay, Ms. Jackie, if you can stop sharing your screen.
Okay.
Thank you. And now we'll rotate to our next speaker again, Ms. Joycelyn Warren, the nurse manager, Twiggs County Health Department.
Good afternoon, everyone. Can you hear me?
Yes.
Awesome. All right. Can everyone see my screen?
Yes.
Awesome. Well, good afternoon. My name is Joycelyn Warren. I am the current nurse manager at the Twiggs County Health Department in Jeffersonville, Georgia. Thank you again to the Fort Valley State University Extension Program for inviting me to participate in this workshop. This information is very much needed at this time. I know we are seemingly on the other side of the pandemic, but there are people still reeling with some of this mental health stuff that we discussed earlier. And so now we're going to talk about COVID-19 itself and the vaccines that are available. I know that this is a very hot topic, and I hope to be able to add some clarity and understanding along the way. So we're going to go ahead and get started. All right, so COVID-19 is a respiratory illness caused by the virus SARS-CoV-2, which is a member of the coronavirus family of viruses. So the respiratory system consists of organs that help you breathe. So that would include your nose, your mouth, your lungs, your throat, voice box, and your airways inside your lungs. Human coronaviruses are common around the world that can cause mild illness, kind of like the common cold. Or they can cause severe illness, such as the Middle East Respiratory Syndrome, or MERS, and severe acute respiratory syndrome, like SARS. And we may remember SARS back in the early 2000s, and it was very similar in nature, but it's one of the coronaviruses as well. So SARS-CoV-2, which is the one we're most familiar with, was identified in 2019. And it quickly spread to impact the entire world, with the first COVID-19 case in the United States that was identified on January 21st, 2020. The first cases of COVID-19 in Georgia were discovered on March 2nd, 2020. So a little bit of trivia for you there. So for the transmission of COVID-19, it's a respiratory illness. So it's spread when an infected person exhales droplets or sneezes droplets and tiny particles that contain the virus. This can happen, like I said, by coughing, sneezing, talking, singing, anything that you use your mouth for or your respiratory for, that's the way it can spread. People can spread COVID-19 without knowing they have it. Some people will never display symptoms of COVID-19 when infected. The only way to know that a person has COVID-19 is to get tested. So let's talk about the symptoms. COVID-19 can cause mild to severe symptoms and death. Symptoms can appear 2 to 14 days after you've been exposed to the virus. So 2 to 14 days, that's 2 weeks. So that is why back in the beginning of this pandemic, there was so much press about, people wearing masks, because you didn't know if you had it or not, because your symptoms were probably, if you had symptoms, your symptoms weren't going to appear right away. So the symptoms are similar to a variety of illnesses that we commonly know. You can get fever, chills, cough, shortness of breath, difficulty breathing, muscle pain, headache, sore throat, new loss of taste or smell, and that was the big one. Congestion or runny nose, nausea, vomiting, diarrhea. With all those symptoms, and a lot of those symptoms are common with a lot of the other stuff that we get, especially in Georgia. So we got, people who have allergies, people get sinus infections, people get colds, and people get the flu. All this looks very similar to that. So that's why it was kind of hard to identify, especially if you started having symptoms. COVID-19 can make pre-existing conditions worse. So pre-existing conditions such as high blood pressure, diabetes, asthma, COPD. This infection can make your symptoms of of your pre-existing conditions worse. So in severe cases, those can lead to hospitalization or death, which is why there was such a push for people with pre-existing conditions back in the early part of this year to go ahead and get the vaccine, because they were more susceptible to more severe symptoms. So this has been run in the ground, but we're going to go over it again. COVID-19 prevention. So wash your hands with soap and water often. Avoid touching your eyes, nose, mouth with unwashed hands. Cover your coughs and your sneezes. Clean your surfaces regularly. Avoid close contact with people who are ill. Use a face mask in public settings. Practice social distancing. So the first 7 bullet points we should all know by heart by now. They've preached them to us for over a year. But the last one has become a reality, and that's the get your COVID-19 shot. And this is going to be the best way to prevent COVID-19. So let's talk about the vaccines a little bit. So 3 vaccines have received emergency use authorization from the Food and Drug Administration, or the FDA. The three vaccines are Pfizer, Moderna, and Janssen, or lovingly known as Johnson & Johnson. So Pfizer received their first emergency use authorization, or EUA, on December 11th, 2020. They were the first vaccine to get an EUA. Moderna followed right behind them for their EUA on December 18th, 2020. Janssen, or J&J, received their EUA on February 27, 2021. They were a little later, but Pfizer just came back and got approval for the FDA to expand their EUA to cover adolescents, those 12 to 15 years old, and they just got that on May the 10th. All three of these COVID-19 vaccines are safe and highly effective against serious illnesses, hospitalization, and death. Pfizer and Moderna require 2 doses, given at least 3 to 4 weeks apart. You should get both doses to be fully vaccinated in order for it to be effective. And then, of course, the Johnson & Johnson is only 1 dose. So I mentioned an EUA in the past slide, but let's talk about that a little bit more. An emergency use authorization for a vaccine is based on the need to use a vaccine quickly to save lives during a public health emergency. Before these vaccines had come about, there were no other treatments that were available for COVID-19. This is the only thing that was available. An emergency use authorization is a shorter process, but no steps are skipped in the safety evaluations. An EUA does not imply that the authorization was done too quickly, nor that the vaccine is not safe. When you've got people dying at the rates that they were dying in the early part of the pandemic, there is a need to quickly save lives. And this was definitely a public health emergency. So everything was vetted accurately. It's just when there's folks dying that fast, you got to do something. So let's talk about the vaccines. So the technology that was used to make these vaccines is called mRNA. mRNA technology is new in vaccine production, but has been used in cancer treatments before these vaccines. mRNA technology has been studied for more than 10 years. mRNA, of course, is messenger RNA. So it's part of our body's system already, and messenger RNAs tells your cells what to do. So the COVID-19 mRNA vaccines give instructions for your cells to make a harmless piece that looks like the spike protein that's on the picture on the right side of your screen. The spike protein is found on the surface of the COVID-19 virus. Our body's going to recognize that this protein should not be there. So they build the antibodies that will remember how to fight the virus that looks like that. So the spike protein is the identifier, and your body's going to remember, okay, anything that looks like that, we're going to go after. Can mRNA vaccines give you COVID-19? No, because all the mRNA vaccine is going to do is give you instructions. It's not giving you the actual virus. And then the mRNA vaccines cannot change your DNA because all they're doing is giving instructions. That's it. Once the mRNA vaccine has given your cells the instructions, it goes away. It disappears. Let's talk about vaccine safety. So vaccines go through more testing than any other pharmaceutical. Step 1 is that small groups of people receive the trial vaccine. Step 2, the vaccine is then given to specific groups by age, race, health, etc. Step 3, the vaccine is given to tens of thousands of people and tested for effectiveness and safety. Step 4, the CDC, or Center for Disease Control, the Advisory Committee on Immunization Practices, or the ACIP, looks at that data to see if the vaccine is safe and it works. Then they give advice to the FDA. The FDA looks at the data and advice from the ACIP and decides whether or not to approve the vaccine. The vaccine is only approved after all these steps are completed, and various teams of reviews are sure that it works and it is safe. So for the EUA timeline, while the timeline for COVID-19 vaccine was quick compared to other vaccines, their safety was always a priority. We had already had helpful information about coronaviruses from our dealing with MERS and SARS. So vaccine development did not begin from scratch. So remember, because coronaviruses are a part of the same family. Many people were excited to participate in clinical trials, so there wasn't really a need to advertise, hey, do you want to participate in this clinical trial? They didn't really have to do any of that advertisement. There were people lining up. The United States and other governments invested a large amount of resources to support vaccine research and development. Like I said before, when people were dying at those rates, something had to be done. So everything else kind of came to a halt, and everybody just pushed forward and put their resources and their time into COVID-19 vaccine development. Vaccine manufacturing happened at the same time as the safety studies, so vaccines were ready to be distributed once they got that approval. So let's talk about vaccine side effects. Serious side effects from vaccines, including the COVID-19 vaccine, are extremely rare. It is possible that some people may have side effects, but they are normal signs that your body is building protection. These side effects may affect your ability to do daily activities, but they should go away in a few days. The most common side effects are minor and include tiredness, headache, pain at the injection site, muscle or joint pain, chills, nausea and or vomiting, and fever. Like I said before, the vaccines, COVID-19 vaccines do not contain the live virus that causes COVID-19. You can't catch COVID-19 from getting the vaccine, nor will you test positive for COVID-19 due to your vaccine. Remember, mRNA vaccines only contain the instructions for your cell to recognize the virus, and then it doesn't contain the actual virus. So side effects associated with the vaccine. If you have a lot of pain or discomfort, please talk to your healthcare provider. If you do not have a healthcare provider or want to report any side effects to the CDC, you will go to cdc.gov/vsafe. Depending on where you go to get your vaccine, you will get this information in that packet that they give you with your vaccine information. vSafe is a program that you can use on a smartphone to quickly tell CDC if you have any side effects after getting the COVID-19 vaccine. And after you get your vaccine, you'll get personalized health check-ins after you receive your vaccine. So when I got my vaccine, I registered for this, and they sent me a message. And for the first couple of weeks, it was every week they were checking in on me. And then when it comes time for your second dose, they remind you that your second dose is due. And then once you get your second dose, you plug it in, and they will check on you for about 4 weeks. And then the check-ins start to spread out a little bit. And so they do maybe every 4 to 6 weeks, and then every 6 to 12 weeks. And I'm not sure when they stop because I'm still getting messages. So it's a way to report those side effects, then, especially if you don't have a primary care doctor. People do want to tell folks, hey, I did have XYZ associated with this vaccine. So this is a safe way to do it, and it helps the CDC to gather that data and to help further science. Let's talk about the J&J pause. The pause of the J&J vaccine was an example of safety monitoring in action. So on April 16th, the FDA and the CDC paused the J&J vaccine after 6 people developed a rare blood clot after vaccination. So after they paused, the scientists studied the data about the clots and who was likely to develop them and what may have caused them. On April 23rd, the FDA and the CDC declared that it was safe to resume using the J&J vaccine, and that they had larger benefits outweighed the tiny risk of using the vaccine. And then they also came out with information in regards to the clots, and then if people were concerned, then they could also just get Moderna or Pfizer. The CDC and the FDA continue to take reports of side effects seriously and investigate severe reports. So when the pause happened, a lot of people became distrustful of the vaccine, and that is understandable. But the thing to remember is that we're watching science in real time. Some of this stuff may have happened with other vaccines that we don't even think twice about now, like a tetanus booster or for kids, the HPV vaccine. But we're watching science in real time, and it is very interesting, but it also, you run into stuff like this. So it is still vetted, that we're still safe. It's interesting to watch it in real time. So some of the common questions for the COVID-19 vaccine. Do you have to pay for it? Nope. This COVID-19 vaccine is free to everyone that is authorized to receive it. You can get the vaccine even if you do not have insurance, a driver's license, or a social security number. The providers may request an administration fee, but they cannot refuse vaccination to anyone who can't pay. At some providers' offices, they will ask you for your insurance card. You're not going to get a bill. We're just trying to get the insurance companies will pay the administration fee to the provider's office. They're not going to send you a bill. Should someone with allergies get the COVID-19 vaccine? So a person with a history of severe allergic reaction to any ingredients in the vaccine should not get the vaccine. Vaccines do not contain eggs, gelatin, preservatives, or latex. Before you get a vaccine, you should get an EUA form that has all the information about the vaccines you're about to get. The ingredient list for the EUA approved vaccine can be found on the FDA website, or you can ask your healthcare provider for one. Should you get the vaccine if you have already had COVID-19? Yes. Even if you've had COVID-19 already, you should still be vaccinated. It could give you longer or better protection against the disease. Even if you test positive for antibodies, you will want to get the vaccine. Right now, we're not too sure about how long the effects from the vaccine last. So even if you do have antibodies after getting the COVID-19 virus, vaccination will help to keep you safer longer. Can someone who is pregnant or breastfeeding get a COVID-19 vaccine? Yes. The American College of Obstetricians and Gynecologists, or ACOG, recommend that the COVID-19 vaccine be offered to pregnant and breastfeeding women. These individuals should consult with their doctor before vaccination, of course. Is the COVID-19 vaccine safe for children? So the Pfizer vaccine is currently the only vaccine available for those 12 and up. Moderna and J&J are authorized for anyone 18 and older. Currently, Moderna says that they are looking to submit their data for approval for 12 years old and up, probably in June or July. So as of right now, no, but I can see that coming down the road soon. Younger children and adolescents should not get the vaccine until it has been approved and until the EUAs are updated. How long will you have protection after the vaccine? Unfortunately, we don't know how long the COVID-19 vaccines will provide protection. Researchers are continuing to conduct studies on all of the available vaccines. Will you need to take precautions after vaccination? Yes, the CDC has updated its recommendations for fully vaccinated individuals. That happened probably, 2 weeks ago, and has stated that fully vaccinated folks can ease up on protective measures. However, everyone should still comply with the rules established by local governments, businesses, and organizations. All right, so we're going to talk about COVID-19 vaccination in Georgia. These numbers are current as of May 24th, so yesterday at noon when I did this PowerPoint. So Georgia has 3.2 million fully vaccinated, which is 31% of our total population in the state. I did numbers for Peach County because Fort Valley is in Peach County. As of yesterday, Peach County has 6,949 fully vaccinated persons, and that is 26% of the county population. Not too sure if that includes your college kids, because they are probably listed in the county that they are from. All right, so we've got two pie charts. The one on the left is for Georgia and the one on the right is for Peach County. Just to compare the numbers, Georgia's got 55% of the white folks, they are vaccinated, as compared to Peach County, you're at 48%. For Black people in Georgia, we're at 23.4%, but in Peach County, you're at 37.7%. We still have a lot of work to do in regards to vaccination, especially in Georgia. Georgia is, our numbers are not great. So hopefully with summer being here, school is out, kids are home, hopefully more people will start to think about vaccinations for themselves and for their children, especially now people are wanting to travel. And local Governments and organizations some of them have requirements about masks and vaccines. And so people want to travel, so they're going to have to comply. And we'll see how that goes. We've got a whole summer to see what happens. So vaccine logistics in Georgia, we're going to start over by the American flag. So vaccines are supplied to the federal government. The federal government decides how to allocate those vaccines to the states. So when the state governments receive the vaccine, it's their decision on how much vaccine goes to the different providers. Providers are such as us, the health department, hospitals, doctors' offices, pharmacies. They receive those doses and administer to them in their communities. So getting a COVID-19 vaccine is a lot easier than it was back in January. The supply is at a high level. Many different providers are offering COVID-19 vaccines. Health departments are still offering them. Doctors' offices are offering them. Pharmacies are offering them. You can find a provider near you at vaccines.gov. All 13 North Central Health District health departments are offering the vaccine. 8 counties provide vaccine without appointments, and those are listed on the screen. You can also go to nchd52.org/COVID vaccine to find out more information. And if you have any questions, you can go to these websites, North Central Health District, that's for our 13 county health departments, the Georgia Department of Public Health, and of course, the CDC. And that is the end of mine. And I believe we're doing question and answers as well.
Yes, thank you, Ms. Warren, for your information. It was good to see that Georgia numbers had gone up from what I had looked at a couple of weeks ago. It was very interesting. But we do have 2 questions in the chat.
Okay.
Question 1, could you explain how herd immunity works?
Okay, I'll do my best. So herd immunity is occurs when there are people, when most people get the treatment or vaccine, more have to get it than to not get it. So you need a majority of your folks to have accepted the treatment or the vaccine in order to protect those who haven't. Right now, Georgia's numbers are not anywhere near us getting herd immunity. We've got a ways to go, but it is possible. So it needs more people to get the vaccine or the treatment than to not have. I hope that explained it kind of. Uh-oh, Ms. Tolbert, I think you're on mute.
I'm sorry.
There you go.
All right. So there's word on the street that there may be a charge forthcoming for COVID vaccination. Have you heard anything with that?
I have not. And I will say that as of today, you can still get it at the health department for free. So if you're worried about any associated costs, you can go to a local county health department.
Okay. Next question. Why were people so ready to be a part of the study, yet many are still hesitant to get the vaccine? If it's because the study people came from existing database, was it because people were getting paid to be in the study?
Now that I don't know for sure, but I do know and remember that people were wanting to be part of it. I'm not sure what kind of compensation they received or if they received any. Yeah, I just don't know about that one.
I know someone that is in one of those paid studies.
Oh, really?
I was just like, okay. So we do have another question.
Okay.
I'm hearing about possible new side effects for young people, possibly related to the heart. Can you provide any additional information? And which vaccines are they finding these side effects in?
So are we talking about heart effects on the heart from the vaccine or from the illness?
From the vaccine.
From the vaccine.
Mm-hmm.
I have not heard anything. We have not been made aware of anything as of yet. So I can't really speak to that.
Okay. And then another question is, I heard the vaccine can cause nerve damage.
Ooh. So that can depend on where it was stuck. That has to do with COVID vaccine administration, not exactly the vaccine itself. There are nerves everywhere in our bodies, and with the administration of the vaccine, it needs to be administered in the top of the arm. And so there's no real way for us to determine. We try to do our best and go in a safe spot. But I have not heard of any nerve damage related to the vaccine itself. Some people complain about a numb arm after getting the vaccine, and that may have to do with the administration.
Does anyone have any other questions that they may not have been able to place into the chat box? I do have another question. What's the percentage of people reporting severe side effects?
I do not have that information. I wish I did. Yeah, we just don't have that information.
Well, let me ask this to piggyback on that. What are some of the severe side effects?
So the side effects that most people are reporting are the ones that we went over in the chat, not in the chat, but in the presentation. Of course, the J&J had the blood clots that were concerning. Have not really heard about any severe life-threatening side effects, and we have not been made aware of any as of today.
Any other questions for Mrs. Warren? And you may ask them, take yourself on mute and ask them verbally.
Yes, I have a question. You said that it's not recommended for people with severe allergic reactions to get the vaccine. When will something be available for people who do suffer from severe allergic reaction to get some type of vaccine for the to be vaccinated for the COVID-19?
All right, thank you for that question. So that we're going to pull back to herd immunity. There are some folks that just can't get vaccines, be it to the ingredients, be it to severe allergies. They just can't do it. And so that's where the herd immunity comes in. You're going to need more people to get it in order to protect those who can't. So that's why it's important for folks to get the vaccine, because there are people who just can't do vaccines. Not even just the COVID vaccine. There are some people who can't do vaccines at all. And so to protect them, we've got to do our part too. Not to say that there may not be a vaccine in the future for them. There just isn't one right now.
Any other questions? Okay. You have thank yous. Thank you so much. Next, thank you so much, ladies, for your expertise in these subject matters in reference to mental health and COVID vaccination. Very educational. I have to admit, I've been reading a lot, and you speaking today, I've learned a lot more. So this is all worked out for me, I can say. Next, we will have Mr. Philip Petway with closing remarks.
Yes, thank you. We want to thank everyone that joined us this afternoon for this important presentation. Could have been done a little earlier, but we felt like we got it done. And just to get, again, just additional information out there for those who may not have taken the vaccine yet, for those that just want to be educated, for those that may be struggling with something mental or anxiety or anything as it relates to COVID-19 or anything else. So just on behalf of the planning committee for this program out of the FACS department and 4-H, we want to thank you for joining us. On behalf of our Dean, Dr. Ralph Noble, for the Dean of College of Ag, Family Science and Technology, Dr. Mark Lattimore, our Associate Dean of Extension for our program, and Mr. Mark Thomas, he's our Director of County Operations. We thank you for joining us today. If you would, we will be posting, sending you the evaluation. If you stick around for 30 seconds or less, we will stick it in the chat box, and I also will be emailing it back out. And we encourage you to go to our Ag FVSU Ag or Ag FVSU website and just see what upcoming programs we may be having, what programs we offer from Extension from Fort Valley State University across South Georgia and across the state. And again, we just thank you for joining us. And again, we will be sharing the link. And just be honest with your evaluation, because your evaluation helps us put together better programming. So with that in mind, again, thank you for joining us, and we are glad that you came out today just to get this information. Now let me do some copying and pasting. FVSU.edu page so that you can see, again, our programs that we offer, any upcoming news and events. And if you, no matter where you are located within the state, you can see which county agent might be able to serve you from our county operations staff. So again, thanks everyone for joining us. And after you evaluate the link or complete the evaluation or click on the link, you're welcome to exit after that. And so that the planning committee could stick around and just do a wrap up. Again, thanks everyone.